for your qualified clinical, as your qualified clinical data registry for PQRS participation. You're probably very familiar with this page. It's off of our data registries page. So if you start from ACR and go to the data registries page, the first box that you see is the qualified clinical data registry. So that's where all of our current information is. One of the pieces we've added recently is this participation checklist. So if you click on it, it tells you what all you need to do right away. So just kind of backing up, March 31st is the absolute last deadline for us to get data to CMS. But as you can all imagine, with many facilities trying to, and entities like us trying to send data, we expect that there will be glitches as we get closer to the end date. So we would like to have the data submitted well in advance. So we hope to finalize everything between us and you by February 15th. That date is not nearly as hard set in stone as some of the other dates, because if there are issues that you uncover and you need to work with us, we might be able to move the February 15th date a little bit, no further than no more than a week or so, but there is some flexibility. The third deadline that you need to be aware of is for those of you who are getting data to the registry for the purposes of PQRS. You need to get your data into us by January 30th. Most of you are probably aware of all the mechanisms we have for submitting data. If you have selected any PQRS measures, then you can submit data using a data upload process or web-based data entry forms. You're probably also aware that for successful reporting, we need 50% of all of your procedures reported to us, and this includes Medicare and non-Medicare patients. So unlike a traditional registry like PQRS Wizard, where you do PQRS measures, it's not just about Medicare, it's also about non-Medicare that we need to collect data on. So the checklist covers, make sure that you're registered for PQRS using the PQRS measures participation if you want to do those measures. There are still a few days left, so if you haven't done this and you think you want to do some of the PQRS measures, you can select this function and submit data. Before you submit data, we need to have a participation agreement that says it's okay for us to collect PQRS measures. There is an addendum that's available on the website, so make sure you have that signed. Those first two items on the checklist do not apply if you're not interested in any PQRS measures. If you only want to do NRDR registry measures towards PQRS from National Mammography Database or the Dose Index Registry, you can ignore those first two steps. So for anyone who's doing PQRS using our measures or PQRS measures, you need to make sure that physicians are aware of this program. They need to review what they need to do in order to successfully participate. The next item, the fourth item, is make sure your TIN is entered on the Manage Physician Group TIN function on the NRDR portal. This really needs to be the physician group TIN, not the facility TIN, because PQRS is a physician-oriented program and we need to have the physician group TIN. Make sure you enroll all of your physicians in the QCDR using Manage Physicians function. Ideally, we would ask you to register your physician for every facility where they participate. If you miss a facility or two, we'll probably still get their data anyway, but just to be safe, if your physicians participate at 6 facilities, just go make sure you enter their NPI at each of those facilities. You can do all this from the master facility login. You can just log in and upload a spreadsheet with this information, but make sure everybody's NPI is entered. When you enter their NPI and select yes for PQRS participation, each of your physicians will receive a link to log in and view their data. The physicians must log into the PQRS physician portal using the link that they receive and attest that they understand that their data are being submitted for PQRS. So I know that some of you are not entirely happy that your physicians are receiving a large number of emails, and we apologize. But unfortunately, CMS requires us to do this. Because it is a physician quality reporting program, they require us to make sure that a physician views and electronically signs to these registration documents and attests that they are aware of what's happening with the data. After we start submitting data, whether it's by Excel file or on one of our other measures, you will be able to review what data are submitted for you. And there are some links here that show you how to get to the Pqrs measures. Some of the data are not quite ready because you're still submitting data. So after January 30th, when we have your data, we will start showing you some reports. So I'm going to show you a sample of what it'll look like. So this will just show up on the physician portal as a functionality sometime early next week. So for every measure for which we have data, you will see a summary of how many records we have and what the performance rates are that we have calculated and the reporting rates. You can review these and determine if they look okay. Did you want to add something, Julie?
I just wanted to say this is not real data.
Correct. At this point, this is all just mock-up pretend data, but when your physicians go in, they'll be able to see their own information. Their NPI will show over there. They can select the year, and really, at this point, we're submitting for 2014, so they should review their data for 2014. Also, please note that all the reporting will be at the level of the TIN and the NPI. So if a physician bills under 5 TINs, we will report 5 times for them, once for each TIN, for each measure. And then once they review these measures, there will be another tab that is labeled CMS submission, and the physician needs to go in there and tell us how many records they submitted. So if you submitted all your records for the year, you can just say, you can check on the 100% box and you're done. But if you only submitted 80% of your records, so let's say we have 85 exams for some measure, and your physician did 105 during the year, we ask you to tell us how many of the relevant procedures you did. That's what we use to calculate the reporting rate and to determine whether the physician had 50%. So instructions for this will start to appear on the physician portal in the next week. But for now, please focus on the data submission and getting the TINs and NPIs in. Next week, you can work on some of this information, make sure we have all the measure denominators that we need so that we can calculate the reporting rate. So going back to the checklist, so we would require physicians to review the data and select the measures. So one of the things you see on this box is a checkbox. So you can select which measures you want us to report to CMS for you. So if there are some measures where the performance rate is much better than others, you want to select them. You may feel free. If there are more than 9 measures available to you as a physician, you have the option of picking your best 9. So you will select, and then you will confirm and sign up. There is an electronic authorization that will be available at the end, and once that is clicked, we will submit data to CMS. There will be opportunity to revise your data if you notice any errors as you're looking at these data. We are allowed to do multiple submissions to CMS. So if we submit data to Medicare, a week later your data changed, we can do a second submission. So you will have several opportunities, but the earlier you get started, the more time you have to work with this. And even though the CMS deadline is March 31st, we would hope to have everything in the early part of March so that we don't get caught in server issues as everyone else is trying to submit their data. So that's all I have. If you have any other questions, you can just look back on our QCDR webpage, and we post updates there frequently. Did you have anything?
Just if you've joined late, Maitre just finished reviewing a checklist for submitting your data that we have posted on our QCDR webpage that you're seeing right now. So if you missed the first few minutes, you can look at the checklist and see what we just went over. Now, I do have one person that has their hand raised for a question, Bernadette Verchewski. So sorry if I mispronounced that. So I'll unmute your line, Bernadette, and you can ask your question. Bernadette?
And Bernadette, if you choose, you can also type in your question and we'll read it off. I see 2 questions from Carlos Diaz about submitting data to the registry and the process of getting set up. That's beyond the scope of this webinar, so we can take that offline. if you would, I know you sent us an email earlier today, so we'll respond to you separately because the process of getting, well, if you're talking about getting set up for the DosIndex registry or any of the other registries, you can look up the specifications on this page over here. You can click on either one of them to see what you need to do for the DosIndex registry, especially for issues such as resolving exam code and exam descriptions. But we will not address that right here. I see a question from Stacy asking, how will the data for ACR 2, 5, and 6 measures be uploaded? We do not see any upload specifications. So measure ACR 2 is a CTC measure, and 5 and 6 are NMD measures. So for any measure that's a CTC measure, you would submit data to our CT colonography registry, and we'll extract the data from the CT colonography registry to report for that physician, for that measure. Similarly, for 5 and 6, which are NMD measures, the National Mammography Database measures, you need to look up the specifications for the National Mammography Database registry. So when you submit data to NMD, we can calculate those measures for you. So NMD is a little bit different from some of the other registries because the mammography measures need 365 days of follow-up before we can finalize them. We need data for all of your exams that were performed in 2013 to be able to calculate measures 5 and 6. If we find some problems in our submitted data next week and we submit some correct data, is it typically a day turnaround to update the physician reports you just displayed? That is our goal, but I cannot guarantee that it's going to be a day. It might be a little bit longer than that. We would just update you depending on what we see the volume is. If the volumes are small enough, we might be able to turn them around quickly. If we see a lot of data getting updated, we might have to fall back to once in 3 days or something like that. But we'll post a schedule depending on how the data come through. Can you walk us through uploading an Excel file as we continue to have problems uploading and we're not sure if it's a naming convention or something else? We have used the template that the Pqrs people gave us. If you're using the right template and naming the file according to the convention that's mentioned and you're still having trouble, just email us because we've had some issues with validating TINs on some browsers. So it's probably a browser-specific issue. And I think it might be better handled specifically for you offline. Do we have to submit data for 2014 or can we start for the 2015 year? You can absolutely start for the 2015 year. You only need, the 2014 is an opportunity for you. So if you submit data to us for 2014, we can report for 2014. If that's not something that's critical for you and you just want to start in 2015, that's fine.
So you can submit data to the registries for 2015 data and services, but the approval for a QCDR comes from CMS on an annual basis, and we won't know until the end of May that we're approved for a 2015 QCDR.
Right. So moving on to the next question. Do I understand you to say that we need to send in 2013 data for the NMD registry? Yes. So send us data for 2013 and 2014, all the exams that you have. Some of your records from 2014 may provide the follow-up that are needed for the 2013 screening exams, but the measures will be calculated based on screening exams that your physicians did in 2013. The next question is, where do you get the template and what databases allow templates? You get the templates when you get the template specifically for each registry when you log in. So for instance, for the Pqrs measures that we offer, when the physician logs in to the Pqrs portal, they will be able to see a template that they can download that they can then populate and upload back. Unfortunately, the Pqrs registry is one of those where I cannot really show you a screenshot because it's designed for a physician login, but we can show you where the user guide is, and that can give you some of the screenshots on how best to get to these data. So again, if you go back to our Radiology Data Registries page and under the QCDR page, the top link is data upload specifications. It tells you what format the data need to be. There is a physician portal user guide, and if you click through the user guide, that has some screenshots that tell you how you will be able to register, find your measures, enter data on web-based forms, or download a template from this interface and then upload data back. For some of our other registries, the National Mammography Database has a data element structure that's specified. And again, if you look at the NMD user guide, it tells you what the data file name needs to be to upload your data. And for NMD, we really need the data to be from a certified vendor because that's what ensures that we get the right data elements from you. But that's where you would get the information. Similarly, for GRID, if you want to submit data on turnaround times, you can log onto the GRID page, and there are instructions on how to upload GRID files. There are specifications for exam-level data, which is what we need to be able to do PQRS submission for you. The next question was that was the email, right? Yes. Who should I email? Please email nrdr@acr.org. Whenever you have any issues or concerns, please email us. We'll forward it to the right IT person, and they will take care of, they will have troubleshoot. You were mentioning 2013 in your comments. 2013 has been done with and over. Yes, it is. 2013 is done with and over, but the way the NMD measures are specified for any mammography audit measures, which is what we have in the National Mammography Database, we need 365 days of follow-up before we can calculate the measure. So the cancer detection rate, for instance, is defined as in the year following the screening mammogram that you read, was there a tissue diagnosis of cancer? And because it is defined that way, your 2014 reporting is based on 2013 screening exams. So you get credit for 2014 for reporting on your 2013 screening exams. Judy, do you want to add anything to that?
I think that's pretty clear. And I understand the confusion on 2013 PQRS reporting. That is done with. The measures for NMD as they were specified were reviewed and approved by CMS, so they are aware that there is a year look back for these measures.
For 2014 reporting year, we did 3 claims-based measures with Medicare patients only. Therefore, we can't upload to you since it would not represent 50% of our patient load. We have also done 5 grid measures through you folks. I believe someone told me we could report both and CMS would select the best outcome. That is what they have told us. Whichever favors you is what they would.
Correct.
Is this a mandatory program for physicians?
The Pqrs is a voluntary program for physicians, but it is now associated with penalties for not reporting, so it's mandatory if you want full reimbursement.
Where do we find the new radiology PQRS measures that are available for the year 2015 from going through a QCDR and not a data registry? We are just in the process of submitting our self-nomination for 2015, so these lists are not quite finalized yet. After we hear back from CMS, this is where the updated information will appear. But that said, of the PQRS measures that we offered in 2014, all but the first, well, actually, we are offering all of these in 2015 as well. They've just changed nature a little bit. PQRS 20 is no longer available through the PQRS program, but you can still do it through NearDear and receive credit for it. Again, this is subject to CMS approving us for this year for that measure, but our plan is to offer all of these measures again for 2015 as well.
Right, and there are no new measures in the Pqrs program, straight Pqrs, not the registry, the QCDR, but there are no new PQRS measures relevant to radiology.
The next question is, can we submit data for measures 2, 5, and 6 through the CT registry and NMD if we currently do not submit monthly data, or do I need to register my RADs and submit retro data? For measures 2, 5, and 6, those data cannot be collected through the dose index registry. Well, oh, you mean CT colonography registry. Yes, you can submit the data through the CT colonography registry and the NMD. It doesn't matter whether you submit data now or not. You can go in, register your RADs, and submit data retroactively for these measures. So you can, the timeline is a little tight, but if you have the data, you can do it. So just go ahead and add CTC and NMD to your registration, make sure your physicians are listed under it, and enter their data. For CTC, it's a web-based data entry form. For NMD, it's an upload. So if you can get the data to us, we will accept it and process it. Are you taking PET CT and nuclear medicine dose data? Yes and no. So not nuclear medicine. We are collecting data on the CT component of the PET CT, but that's not part of the PQRS measures that are selected for this year. The DIR measures that are part of the PQRS program as we submitted them are relate to head CTs, abdomen pelvis CTs, and chest CTs. The PET CTs are not part of this program. You might mention the cross-cutting measures don't apply if you use the registry in 2015.
Thank you, Christine. That is an excellent point. So there is a new requirement for 2015 PQRS reporting to report a cross-cutting measure. There are, I think, 19 cross-cutting measures, which are, for the most part, based on evaluation and management codes. And if a physician or eligible provider sees one patient in a face-to-face encounter, then they're responsible for reporting a cross-cutting measure if they can. So that's a requirement if you are doing PQRS through claims-based reporting or the traditional qualified registry reporting, but it is not a requirement for QCDR reporting. And I'm sorry, you can find more information on 2015 reporting on the ACR website under quality measurement.
And just to help you navigate under quality and safety, quality measurement, that's where you'll find PQRS information. Submitting data for 2014, but in preparing for 2015 QCDR, where do we locate the non-PQRS measures for 2015? Web page is only listing 2014 as of now. The measures are going to be the same. So we're not, we are planning to offer a few more near-your non-PQRS measures, but those will be out of the lung cancer screening registry, which will be available in spring of this year. So the current list is exactly what you see for 2015 as well. So out of our existing registry, so long as you keep doing the measures out of here, you are taking advantage of everything we have to offer.
I would also like to point out that the perioperative care measures 21, 22, and 23, those remain in the PQRS program. So if you're reporting through claims or the traditional qualified registry, you can still report those measures. However, CMS in their 2015 specifications has not updated the codes, the CPT-1 codes that enable a number of particularly interventional radiologists to report those measures. They're basically vertebroplasty and kyphoplasty. The PQRS measure specifications contain the old codes for those procedures that were updated in 2014 and do not contain the new CPT codes for those procedures. So if you're reporting through claims or traditional registry, if you've reported those measures in the past, you're likely not able to report them that way in 2015 because you're not going to be billing the codes that are in the measure specifications. So we, as part of the QCDR, we intend to submit to CMS in our self-nomination that we can report 21, 22, and 23 as Pqrs measures, and we are looking at doing some crosswalk between the measures in the Pqrs specifications and the codes that you would actually use. So we'll just have to stay tuned on those three measures
But yeah,
for 2015.
so they may change character from being PQRS to non-PQRS, but as far as the submissions are concerned, you should be able to continue using these measures as available.
Right.
Back to measures 2, 5, and 6. Can we submit cumulative data for the year, or do I need to input the data month by month? We need a record for every exam. So we cannot accept aggregates at the monthly or the annual level. We need a record for every month. But you can submit one file that has every exam record for the whole year. CMS requires us to have exam level data so that we can then calculate the measures on uniformly for everybody to submit. On the cross-cutting measures, how does CMS interpret face-to-face? Do you have to bill line codes?
So that's a good question, Suzanne, and it is confusing the way that CMS has described that requirement, and there's also some conflicting information that we're trying to clear up. So the two pieces of the cross-cutting measure requirement is that, one, if an EP sees a patient in a face-to-face encounter, then they have to report the cross-cutting measures. And on their website, it's also on the ACR website, CMS has posted a list of over 6,000 CPT and HCPCS codes that are considered face-to-face encounters. And so these include a vast selection of measures from evaluation and management codes to surgical codes to incision codes and the like. So that's the code set that flags whether you should report a cross-cutting measure. However, the 19 cross-cutting measures that CMS says that you should report, those measures denominator CPT codes basically only include the evaluation and management codes that are in the 9,000 series. So if you don't bill those types of services, then you're not able to report a cross-cutting measure, and you should not be held accountable for them. But we are looking for clearer confirmation from CMS on that fact.
Chris has a follow-up.
Okay.
The CPT list included some injection codes and a few ultrasounds for some reason.
That's correct. So that's another piece of information that's conflicting. The code list, the face-to-face encounter code list of 6,000 plus codes, also has a list of exclusion categories from the face-to-face encounter list. And those exclusion categories are just that, categories. They don't list specific codes, but there are categories such as injections and diagnostic radiology procedure or exams, nuclear medicine, and ultrasound. Yet on the face-to-face encounter code list, you will see codes for duplex scans and some injection codes. So the ACR is in the process of trying to crosswalk the exclusion categories and the face-to-face encounter code list and submit that to CMS to see if they will remove from the face-to-face encounter code list certain codes. So you have to stay posted on that as well.
Moving on to some of the questions that we received by email. The first one is on NMD measures for ACR, for APRAD 6, biopsy recommendation and tissue diagnosis within 12 months. We weren't sure how to report scenarios where patient and physician chose not to biopsy and left the date blank, couldn't get a response and left a date blank, which are similar, but in NMD they'll look the same. have a result but not the biopsy date, left the biopsy date blank but reported the results. All of those are fine. If the date's blank and the result's blank, we will just treat it as an exam where we don't know, that we don't have confirmation of a tissue diagnosis. So it will actually kind of count against the physician, but hopefully everybody has a small enough number of these that it won't reflect poorly on them when compared to the average. This is how the measure is specified. I believe if the biopsy date is blank but we have the results, we will still use the field. I can check and confirm. But one of the things to note is for this year, for 2014, the performance rate itself does not matter very much. The only thing that matters is whether you have submitted or not. In 2015, your performance relative to your peers will start to matter. So to the extent that you find issues with your data, this is the year to get used to it and see what you can do to improve the data quality for 2015 so that you can present your best face for 2015. Is there anything to add to that on the performance rates?
Yes, so just as a reminder, the Pqrs program success is considered that you are reporting successfully. So you're reporting 9 measures across 3 domains and 1 outcome measure for the QCDR reporting for 50% of all the patients relevant to the measures. But for the value modifier program, the performance scores of the measures that you've reported are what is looked at to consider for quality tiering under the value modifier and potential upward, neutral, or downward adjustment in future years. So for 2015, the Pqrs performance rates will affect the 2017 value modifier, and that could negatively, positively, or neutrally affect groups of 10 or more in 2017 based on 2015 reporting.
Going back to a question from the webinar, if we have triad software, can we submit reports retrospectively? Absolutely. You can use the data to submit records for the past year. If you have a large volume, please try to submit them at night so that our servers are not overwhelmed, but beyond that, we will certainly accept them. While we wait for more people to ask questions on the webinar, I'm going back to some of the email questions. For ACRAD 15 to 18, report turnaround time, we uploaded a year's worth of detailed data. Will you provide reports feedback with the calculated turnaround time for those exams and compare us to other places like you did with the IR? That is the plan. So next year, I think, sorry, next week, you will start to see summaries for each position and hopefully a DIR average. So our plan is to start working on these pretty much as soon as people stop submitting data. So I think by mid to late next week, some of these results should start to appear. So this won't be this version will not be as detailed as you're used to seeing with DIR, but in the next month or so, we will use the same data to generate DIR-like reports to see for grid as well. So right now we are focusing a little bit on getting the Pqrs participation done. If you're submitting other data to grid, you will still receive your grid reports like you always do. But for the turnaround time data, it might be another month or so before we do the comparison reports in great detail. What type of data will we be reviewing before final submission, and where do radiologists go to choose the measures they want to report? Like I mentioned, all of this should start appearing on the physician portal like mid to late next week, and those were the screenshots we showed you. This is where they will be able to review and check off and approve and give us permission to submit data to CMS. In reporting year 2015, do all of our radiologists need to meet the 50% reporting standard on all the measures within the group of related non-PQRS measures in order for them to get credit on all the measures? For example, if one radiologist reads PET scans, can each of the rest of the radiologists get credit for PET turnaround time as well as the 4 turnaround time measures they routinely read? You don't have to submit measures for the whole group. You just submit for a whole group of measures to submit for whatever you do, and only the person who reads the PET scans gets credit for the PET turnaround time. If the other physicians are reading other modalities, they're reading the 4 other modalities, that's what they get credit for. So everyone gets credit for whatever measure they report on, whatever. The routinely read is a little tricky. As far as our registry is concerned, that doesn't matter. If you just read 5 exams in the modality during a year and you have a turnaround time to report for that, we'll take it and we'll report it. There is not really a minimum for how much you need to do. So long as you do 50% of all the studies, CMS will acknowledge that you meet your participation requirements. For NRDR, we actually require that you submit all your records to us. So we don't want you picking. If it turns out that you only have 50% because you didn't start submitting until July, that's one thing. But through the year, we really ask for all of your records so that we can then process your reports periodically, show you how you're doing across all your records and not just half of them. So there is one exception to the rule of physicians only getting credit for what they do, and that is the dose index registry. For the dose index registry, the measures are defined for a facility. So all the NPIs that report under 810 will get credit for the average dose measure done under that 10. So if you have 3 facilities that report under the same 10, then the average CTDR, the average SSDE or DLP, as the measure states, across all of those facilities for the specified measure will be calculated, and the same number will be reported as the performance measure for each of the NPIs that are part of that 10. So that's the only one where physicians get to share credit. So you calculate it for the group and everyone gets credit. For all of the other measures, they are calculated at the level of the individual and reported individually. The question, the next question is, do you use data submitted from the NRDR or additional data submitted? For all of the non-PQRS measures, for the NRDR measures, we use data from the NRDR. The only exception is when we have to calculate the reporting rate to make sure you submitted more than 50% of the records to us. So next week when the screen becomes available, you'll see the NRDR measures here as well. If you have been submitting 100% of your cases to NRDR, you just check that box and you're done. Everything you need comes from NRDR. There's nothing more to do. If your physicians did not start submitting data until partway through the year, or for some reason there was a disruption in the data submission or something like that, if for some reason NRDR does not have 100% of the cases that you did during the year, then we will ask you to enter the total number to say how many did you do. So for instance, if this is a screening mammography measure, we'll ask how many screening mammography measures did you do in 2013? And you'll enter that number over here, and we'll use that to calculate the reporting rate. But all of the performance numbers, what the recall rate was or what the cancer detection was, that directly comes from NRDR. You don't have to do anything extra. Next question from email. Please explain cross-cutting measures and confirm that those participating in a QCDR are not required to do these. I think this has been addressed.
Yes.
For reporting year 2015, will we be subject to value-based payment modifier adjustments because we have 10 EPs?
Yes.
Yeah. Okay. Don't see any other questions. If an EP has 0 encounters for a particular modality, does he or she still need to attest for PQRS?
You, for a measure to count for PQRS, you have to have at least 1 patient in the denominator, unless the measure has medical or system exclusions, and all those patients are excluded from the denominator by way of the exclusion category. So you would have you're still reporting what patients you have, but they're excluded from the calculations. So in that case, zero encounter, it turns out to be a zero encounter, but you do have to have actual patients in the denominator to use the measure.
Is that a question about Attest for the research?
So if, in terms of the QCDR reporting, if that's what you're asking for the selecting the measure, if you have zero patients, then you wouldn't check that measure. That's what you're asking. Yes, you're welcome. We're just waiting for other questions that people might have.
Going back to the value-based payment modifier question, CMS says this does not apply if practice participates in the Medicare shared savings plan. Please confirm.
To date, that is true, that the value modifier doesn't apply to providers or groups in an ACO, accountable care organization, in the Medicare shared savings plan. However, in the Medicare physician fee schedule final rule for calendar year 2015, CMS finalized starting to apply the value modifier to ACOs. So if you would contact me, Virginia, about the starting date for that, it does depend on certain characteristics, but it won't be for 2017 based on 2015 reporting. The ACOs or those in shared savings won't have a negative adjustment under the value modifier.
If we currently upload data to RadPure, will that data automatically populate to Pqrs? RadPure is not part of the QCDR. We don't have any RadPure measures for Pqrs. So unfortunately, no. We do have PQI projects for the ABR out of RadPure, but no Pqrs measures. So just again for reference, the measures that are available for PQRS out of the National Radiology Data Registry are on this QCDR page, and they are listed right here. So that's the PQRS measures and the non-PQRS measures, and that shows you what we have available. So if they're not seeing any more questions, I think we'll go ahead and end the webinar, but just please feel free to reach out if you think of any other questions. Oh, there's one more. Do we have to put this information in manually, or can our billing company do this for us? Your billing company can absolutely do this for you. So if you show them, if you can download the, well, it depends on what you're talking about. So for the PQRS measures, you can probably download the template from the physician portal website and pass it on to your billing company, and they should be able to populate it with the right fields for you to upload. Also, if
however, if I can interrupt there for a minute, so your billing company, or you can do that through your practice management software, you can get the measure, the cases information, but you do have to indicate whether or not the measure was met. And if your billing company has that, if they're tracking that in terms of PQRS, then they may be able to give you that yes/no information, but you might have to go back and research that through your through the radiology reports if they don't track the CPT-2 codes for the cases.
And they need to be doing this for Medicare and for the non-Medicare patients for us to be able to get those data.
Right.
So the template right now is only available when you log in. There are a couple of ways you can do this. So you can log in as a physician, if any of your physicians have a login, and they will be able to download the data from the physician portal. The other, like I said, if they log in as a physician, they go to this upload data, there is a template available for them to download over here. But alternatively, if you're on our Pqrs QCDR page, the first link is Pqrs measures data upload specifications. You can pass that on to your billing company, and they might be able to work with that. Also, if you have a billing company that's interested and has more technical questions, have them contact us. We'll get them in touch with our IT people, and they might be able to kind of develop some functionality that many of their customers can use, and not just you. This is for physicians, not hospitals, correct? Yes. All of this is at the physician level for the PQRS measures and for physician groups. So it's not really facility measures, they are physician group measures.
Right, but the data can be coming from the facility, like particularly for the dose index registry. So we do have more time. We have allotted until 3 o'clock. So if there are things that we've said that, I know there's a lot of information that we've discussed, so if there's a question you have on what we've already talked about, or if something wasn't clear, please feel free to ask again.
Will you be offering a 2015 reporting webinar later this year? Oh, yes, absolutely.
And also, we'll be putting together a 2015 PQRS and value modifier webinar separate from that.
So we'll have a series of webinars through the year to address various aspects of the program. And hopefully 2015 will be a little bit more relaxed, a little less hurried than 2014 was, because we have some of these tools in place now. The cost of $199 per physician per year, is that for each measure we are submitting? No, it's just $199 per physician per year. That's it. And we will report 9 measures, and well, any number of measures that your physician wants to report for that price across all the facilities from which we are pulling data. The CMS requirement is for physician reimbursement. Yes.
Yes. It's for Medicare Part B fee-for-service.
So no facility maximum by physician. No. If an MPI physician practices at 10 sites, 20 sites, yeah, that's fine. Any number of sites is okay. So the way the system works is when you add the physician at the first site, it creates an account for them, and that's the level, and they're billed for the reporting through that account. And then any other facilities where you list them will pull the data from all those facilities, group them by 10. So if they use one 10 at 3 of the sites and another 10 at the other 7, they'll have 2 rows to report on for each NPI-10 combination. All of that is covered under the physician reporting. So you just pay that one fee, and we report everything that you want us to report for that physician. I'm new to this program. Is data no longer able to be submitted for this year? No, you do still have time to submit data for this year. We have a deadline of Friday, of January 30th, to get all of your data in for 2014. If you have the data already available, you should, I don't think there'll be much problem for you to send it, and we can accept it. If you need to get set up with your vendor to submit the data, the timeline might be a little bit challenging. But this is why we're talking today, that if you have any issues with the data submission, we wanted to reach out to you before the deadline, before our deadline for us to receive your data. So you have until Friday, end of the day, to get your data into us.
And as a reminder, for the 2015 reporting year, this is the last year that there is an incentive associated with Pqrs. And using a QCDR, to get the incentive, you have to meet the full reporting requirements, the 9 measures across 3 domains and 1 outcome measure for 50% of all patients. But to avoid the penalty associated with 2014 reporting, you can report a minimum of 3 measures from the QCDR and not receive a penalty.
If the log shows errors after uploading the registry, must we fix them? If you're comfortable that the good files will exceed 50%, can we leave them? Yes. If you're confident that it exceeds 50%, don't worry about it. I missed the first part of the webinar. Can you walk us through the first steps to do the Pqrs portion of the system? I would suggest that you go to the QCDR page, and we have a checklist that tells you what you need to do. And every step of the checklist has a link associated with it that has documentation on how to go through those steps. The first 2 items relate to doing Pqrs measures through near-dear. The rest of them apply for everybody. So if you're doing any Pqrs measures, then those 2 apply to you. Penalty from whom?
It's a CMS penalty for not successfully participating in Pqrs. For the 2014 Pqrs reporting year, the penalty is a negative 2% that will be assessed in 2016, and that will be on a per claim basis.
Can you explain what is successful participation?
Yes. So that, just as we said, for 2014 program year, the 2014 Pqrs year, using a qualified clinical data registry, the QCDR, like near-dear, the requirements for obtaining the incentive are reporting 9 measures, this is per physician, 9 measures across 3 national quality strategy domains, and one of those measures must be an outcome measure. And 19 of the 20 measures in the ACR's QCDR are considered outcome measures, so hopefully you wouldn't have trouble with that requirement. And for those measures that you report, you have to report on 50% of all cases, patient cases related to the measure, both Medicare and non-Medicare patients.
As long as one EP under a 10 meets, then the whole group is safe from the penalty. For example, if 4 don't meet and 1 does, the 10 is held harmless?
Unfortunately, no. That is true if you are a registered group practice reporting option group, a GPRO group, to some extent. But currently, GPROs aren't allowed to use QCDRs, so that wouldn't hold true at all for a QCDR reporting. It's individual 10 NPI combination where success must be, you must be successful in order to avoid the penalty.
If you're not going to report in 2014, since it was voluntary, will the penalty still apply?
And I'm sorry, Melissa, let me go back to Jody's question. example is if 4 don't meet and 1 does, the 10 is held harmless. So for the Pqrs penalty, that is individual 10 NPI. So the other NPIs in your group won't receive the penalty if just 1 in your group does. It's specific to the NPI's claims. So in that case, I mean, that's true for individuals reporting through a QCDR or individuals reporting through other mechanisms. Sorry, going back to Melissa's question, if we are not going to report in 2014 since it was voluntary, will the penalty still apply? Yes, the penalty will apply because 2014 there was the potential for either an incentive or penalty. In 2013, that was true. That was the first year where a penalty may apply. So for 2014, if you don't meet the minimum requirements for avoiding the penalty, which are reporting 3 measures from a QCDR, then a penalty will be assessed in 2016.
Does volume matter? If we say 50% of all cases for that MD and the volume is 1, does that matter as long as 1 met the criteria?
Yes, that if you have 1 patient case for a measure and you report that one, that's 100%.
Yeah, you're done. It doesn't matter. So I think, so this is, I think, one of the advantages of having some of our mammography measures. If you have any physicians that just read the minimum MQSA volume, they can still report the NMD measures successfully so long as they submit all their cases to us for the registry. We're at 2:30, and the questions, I mean, we still have another half hour, but we don't have as many questions. So I think I'll give it another 2 minutes, and if we don't see any questions, we'll go ahead and end the webinar. And as Judy mentioned, please feel free to email us your questions. Have you found many customers that are successful at submitting 9 measures per MD successfully? Yes, there are several. So we won't know for sure until we're done reporting, because that's when we'll have the final numbers, and we'll try to do some summaries on our website to say how many physicians reported successfully. But with the DIR and the NMD measures available, I think there are a number of physicians who have managed to get to the 9.
The problem areas are for subspecialists that do pretty much only MR or certain exam types that just don't fit under the registries that we have, or there aren't relevant Pqrs measures. So there definitely are those radiologists that won't be able to find 9 measures through the QCDR. And then if that's true, we would recommend for 2015 reporting that they continue to or start to use the claims-based reporting or the qualified traditional registry reporting, because if they report all the measures that are available to them, then they can still be successful and avoid the penalty. So that may be the way to go for some members of your group. So you can do that type of reporting for some of the members in your group and use a QCDR for those that can find 9 measures.
Have you heard of how many EPs across the U.S. are not participating versus those who are participating?
The latest numbers we have for that from CMS are for 20, sorry, I can't remember if it's 2012 or 2013 reporting, but about 50% of radiologists in 2012 or 13 were participating in PQRS. That radiologists were in the top 10 specialties for those that are participating. So there were many specialties that the percentage is much lower. But I think overall, nationally for all physicians, it's around it was around 30 to 40%. But I'm positive those numbers will increase for 2014. For 2013 was the first year that the penalty was in place, and so many practices have gotten letters from CMS notifying them of a penalty to be assessed this year based on not reporting in 2013.
And the QCDR is a new mechanism, and 2014 is our first year, so we'll have to see how that plays out in terms of either increasing the reporting or just kind of moving them from the Pqrs to the system. But we should have more information after we are done reporting.
Right. And I'll have to say, too, that those statistics showed that in that reporting year, 2012 or 13, sorry, I can't remember, most people submitted using the claims-based reporting mechanism. And so that's still very popular and very viable for a number of practices to use. Using registries is increasing for a number of reasons. CMS is also, for several years, has intimated that they wanted to rely less on claims-based reporting. They are starting to remove measures from the program that were used for only claims-based reporting, and they aren't accepting new measures into the program that can only be reported through claims. So they are sort of switching gears a little bit, but it still will remain a viable option for many groups in the next few years.
Let's see if anybody breaks the 2-minute.
Okay.
2-minute limit that I keep setting. We have one more question.
And if we don't have any more questions, we would like to thank all of you for, one, participating in this webinar, but also your energy in choosing the ACR's QCDR for Pqrs reporting, and we want to continue to support you in that way.
And thank you very much for all your patience in working with us through all the data glitches and all the issues we've been having. We are kind of learning about this as you are, and trying to manage it as best we can. Hopefully this process will get smoother as we progress through 2015, and the next round of reporting will be much more glitch-free. So thank you again for your time. Oh, one more. Is there any reason why you would not be accepted in 2015? We hope not.
But we certainly can't see that there would be. We're basically doing the same thing, potentially adding some new measures, but CMS is really pleased and happy about the QCDR options, so they're pretty much welcoming all reasonable comers to the program.
So on that positive note, thank you again, and we look forward to interacting much more with you in the next few weeks as we get through this process. Bye.